The emergency department was slammed. 3 trauma cases from a multi-car accident, 2 critical patients in surgery, every attending physician occupied with life-threatening situations. Which meant, when the man in the lobby went into cardiac arrest at 2:47 p.m., there was nobody available to help him. Nobody except Evelyn Rodriguez, the 58-year-old woman behind the reception desk, who most people assumed had never done anything more medically complex than scheduling appointments. They were wrong. Very wrong. Evelyn had performed over 3,000 cardiac surgeries in her career, pioneered techniques still being taught in medical schools, and held the record for the fastest successful emergency coronary bypass in Johns Hopkins history. But that was before she'd walked away from medicine entirely. Now, she had about 3 minutes to decide whether to stay behind her desk and let this man die, or reveal that the hospital receptionist was actually Dr. Evelyn Rodriguez, and she knew exactly how to save him. Evelyn had worked at Metropolitan General Hospital for 4 years, sitting behind the main reception desk, checking in patients, answering phones, directing visitors. She wore simple scrubs, kept her graying dark hair pulled back in a practical bun, spoke with a slight accent that made some people talk to her slowly. She made $16 an hour and went home to her small apartment where nobody knew she'd once been Chief of Cardiothoracic Surgery at Johns Hopkins. The other reception staff treated her kindly, but with casual dismissiveness. The nurses walked past her desk without really seeing her. The doctors never looked twice. She was exactly what people expected a hospital receptionist to be, someone who'd never been inside an operating room, who didn't understand medical terminology, who scheduled appointments and answered basic questions. And Evelyn had carefully maintained that invisibility for 4 years. What nobody knew was that Dr. Evelyn Rodriguez had spent 30 years at the top of her field. She'd completed her surgical residency at Massachusetts General, her fellowship at Stanford, joined the Hopkins faculty at 34. She'd performed groundbreaking research on minimally invasive cardiac procedures, published over 60 papers, trained hundreds of residents. She'd been offered department head positions at every major medical center in America. She'd saved lives that seemed unsavable, fixed hearts other surgeons had declared beyond repair. And then, her husband Miguel had gotten sick. Pancreatic cancer, stage 4. 6 months from diagnosis to death, 6 months when Evelyn had been trying to maintain her surgical schedule while watching him die. She'd missed his last lucid conversation because she'd been in surgery. She'd been at the hospital when he died, but not with him. She'd been updating a patient's family while her husband took his last breath with only a hospice nurse present. 3 months after Miguel's funeral, Evelyn had resigned from Hopkins and taken the first job she could find that had nothing to do with life or death decisions. A hospital reception desk seemed perfect, still in medicine technically, but no responsibility for outcomes, no surgeries to prioritize over family, no weight of knowing your decisions determined whether people lived or died. Now, watching the man collapse, Evelyn made the calculation she'd been avoiding for 4 years. The nearest physician was 3 floors away in surgery. The emergency department was overwhelmed. The code team was running to another emergency. This man had maybe 3 minutes before irreversible damage, maybe 5 before death. And Evelyn was the only person in this lobby who knew exactly what was happening and exactly how to fix it. She stood up and walked around the desk. The man was on the floor, unconscious, not breathing. Evelyn knelt beside him with movements that were calm, efficient, automatic. She checked for pulse, weak, barely palpable. Checked airway, clear, assessed breathing, absent. Her hands found the landmarks, began compressions with precise rhythm and depth. A nurse appeared with a crash cart, saw the receptionist doing compressions, and moved to take over. "Ma'am, step aside, please. We're trained for—" "My name is Evelyn Rodriguez," Evelyn said without breaking rhythm. "I'm a cardiac surgeon. I need you to bag him, get me an ECG, start 2 large-bore IVS, and call the cath lab because this patient is having an acute MI and needs emergency intervention." The nurse stared. "You're the receptionist." "I'm also a surgeon, and right now I'm the only one available. We can discuss my job title later, or you can help me save this man's life. Choose quickly." The nurse chose. Within 90 seconds, they had him intubated, IVs started, monitors showing the ECG that confirmed what Evelyn already knew. Massive anterior wall MI. This man needed a cath lab immediately. Another nurse appeared, then a resident who'd heard the code. They stared at the receptionist, giving orders with absolute authority. Aspirin, 325 milligrams, heparin bolus, get his medical history. And somebody call interventional cardiology right now because he needs an emergency cath, but the cath lab is 30 minutes away and he doesn't have 30 minutes. The resident pulled out his phone. "I'll call, but who are—" "Dr. Evelyn Rodriguez, former Chief of Cardiothoracic Surgery at Johns Hopkins. I've performed over 3,000 cardiac surgeries. This patient is in cardiogenic shock and we need to move now. You can verify my credentials later. Right now, make the call." The cardiologist on duty, Dr. Peterson, someone who'd walked past her desk dozens of times, arrived 6 minutes later, took one look at the receptionist managing the code, and stopped dead. Evelyn Rodriguez? The Evelyn Rodriguez? From Hopkins? "Yes. Your patient has an acute anterior MI. He's been down for 8 minutes. We've got him stabilized, but he needs the cath lab immediately. The cath lab is backed up. Earliest is 45 minutes. He doesn't have 45 minutes. His left main is probably occluded based on these ECG changes. He needs intervention within 15 minutes, or we're looking at massive irreversible damage." Dr. Peterson looked at the monitor, looked at Evelyn. "If you're right about the left main, he needs surgery, not a cath. He needs a bypass." "I know," Evelyn said quietly. "I'm very aware of what he needs." The silence was heavy with implication. "Are you saying you could—" "I haven't operated in 4 years. But yes, I could. If you have an OR available and a team willing to assist someone they've been walking past at the reception desk, without realizing she used to run one of the best cardiac surgery programs in the country. But we need to decide in the next 2 minutes." Dr. Peterson made 3 phone calls. 10 minutes later, Evelyn was scrubbing in for the first time in 4 years, surrounded by a team still processing that their receptionist was actually a world-renowned surgeon. The anesthesiologist kept staring. The scrub nurse looked shocked. The resident was Googling her name right up until they draped the patient. Evelyn blocked it all out. She'd spent 4 years trying to forget this feeling, the weight of a life in your hands, the absolute focus required. She'd walked away because she couldn't bear it anymore, because prioritizing surgery over family had cost her everything. But standing at that operating table, scalpel in hand, she realized something. Walking away hadn't made the knowledge disappear. It hadn't erased the skills. It had just meant choosing not to use them. And choosing not to save a life when you could wasn't peace. It was just a different kind of failure. The surgery took 4 hours. Emergency triple bypass complicated by the delay, but Evelyn's hands remembered everything. The techniques she'd pioneered, the adjustments that made the difference between good and exceptional, the ability to read a heart and know exactly what it needed. The team watched with growing amazement. When she closed the last incision and the patient's heart was beating strong and steady, she felt something she hadn't felt in 4 years. The profound satisfaction of having saved a life that would have been lost, not because she'd prioritized it over family, but because she'd been there, had the skills, and chose to use them. 2 weeks later, the hospital board held an emergency meeting. The CEO wanted to know why someone with her credentials had been working reception. The chief of surgery wanted her back in the OR immediately. The board wanted to offer her whatever it took. Evelyn sat across from them and said, "I'll come back to surgery, part-time, 2 days a week in the OR, teaching rounds with residents, maybe some research. But I keep my reception position the other 3 days." They stared. "Why would you want to keep a reception job when you could—" "Because for 4 years, I've sat at that desk and watched this hospital from a perspective none of you have. I've seen how patients are treated when they're scared. I've heard how staff talk about people when they think nobody important is listening. I've learned what it's like to be invisible, to be dismissed. And I don't want to be the kind of surgeon who only sees patients as cases. I want to remember what it feels like to be on the other side of that power dynamic. 6 months later, Dr. Evelyn Rodriguez worked 3 days at reception and 2 days in cardiac surgery. The residents who trained under her learned not just technical skills, but empathy for every person in the hospital. The nurses who'd walked past her for years now stopped to talk. The patients who checked in at her desk sometimes recognized her later in pre-op and were amazed their surgeon had been the kind woman who'd helped them find the right department. Evelyn had learned that you didn't have to choose between being the receptionist and being the surgeon. You could be both. You could answer phones at 9 a.m. and save lives in the OR at 1 p.m. You could hold space for grief while also honoring the skills that could save other families. Some skills didn't fade just because you stopped using them. Some knowledge stayed sharp even when buried under years of intentional invisibility. And some people were exactly what they appeared to be, until the moment they decided to acknowledge all the parts of who they were: the receptionist and the surgeon, the grief-stricken widow and the life-saving physician. Both were real. Both mattered. And both could exist in the same person, making a difference in ways that went far beyond any single job title. If you enjoyed this story of hidden brilliance and the power of underestimated expertise, don't forget to hit the subscribe button and smash that like button for more powerful stories of people who proved that age is just a number and that the most dangerous capabilities often hide behind the most ordinary appearances. What would you do? Stay silent and protect your peace, or reveal yourself to save people who disrespected you? Drop your thoughts below. Where are you watching from? Let us know your country in the comments. We love hearing from our amazing community around the world.